Hey, welcome to another episode of Clear Lake Connections, proudly sponsored by UTMB Health, where we talk to the people behind the businesses of Bay Area Houston. Today's special guest is Rachel Hogan, and you are with Shriners Hospital, and in particular, the Cleft Lip and Cleft Palate.
Correct, the team
Center.
there. Yep.
Okay. Tell us about your involvement with Shriners and maybe a little bit of background on the hospital and what your role is.
Sure. So I've been with Shriners for 5 years. I've worked through the Cleft Lip and Palate team as a speech pathologist, and now I'm the clinical coordinator as well as the speech pathologist with this team. We offer comprehensive care from birth and prenatally all the way through very early adulthood with kiddos with cleft lip and or cleft palate. It's a full team approach, so we have many providers on our team. We have plastic surgery, ear, nose, and throat, speech pathology, dental, oral and maxillofacial surgeon, orthodontics, genetics. I'm sure I'm missing one, but it's a full comprehensive team, including nurses and other care providers to help make the team run smoothly and give the patients the best care in one spot.
Okay, and so for people that don't quite know what a cleft lip or a cleft palate is, tell us what that is and what are some of the dangers associated with it?
Sure. So a cleft lip is an opening in the lip that during in utero, your lip or palate didn't fuse at the right time in the early weeks and months. So a cleft lip would be the opening in the lip. A palate would be an opening in the roof of the mouth. You can have one or the other or both. There are risks of, as an infant, poor feeding or difficulty gaining weight. And then you're into childhood, speech problems, dental problems, potential feeding problems into childhood and adulthood. And there's just a kind of a myriad of scheduled surgeries that we anticipate, but it's not like it's not a prescription for every kid with this diagnosis gets these things. So we're always tailor fitting our care to these patients.
So there's probably a range of severity and
Sure. Or we expect with one diagnosis we'll do these surgeries, but then not all of the kids need them. Or maybe somebody doesn't need orthodontics until later instead of earlier or at all. Or some kids don't need speech therapy and others very much struggle in that area.
Yeah, and I think for a visual, if I'm thinking about the actor Joaquin Phoenix, probably one of the most famous people I know.
I'm pretty sure he has a microform cleft lip.
Yeah, it gives people kind of an idea
Sure, yep.
what it is. So how many patients do you guys see on a yearly basis?
Weekly, so we hold clinic once a week, and we see anywhere between 25 and 35 or 40 patients a week. I'm not sure what that comes out to within a year. I think last check it was somewhere in the 500 range, but that was prior to COVID.
So how common is this?
The prevalence is about 1 in 700 to 1 in 1,000 live births present with a cleft lip and or cleft palate. So It's more common than you think.
Okay, so 1 in 700.
Yep.
Okay. And talk about kind of like if my child is born and has a cleft lip or cleft palate,
Sure.
and I bring them to you, tell me what I'd be expecting and what that would look like.
So again, you'd get comprehensive team care. If you would bring your baby to us for an initial maybe 3 or 6 month appointment, we would make sure that the baby is feeding well, gaining weight well. Usually with a cleft palate is where we have the issues with feeding. If it's a lip only, the baby should be able to feed like any other non-clefted child. However, sometimes they need support or tweaks too. You would meet with your plastic surgeon who would eventually do a surgery with your baby to repair the lip or the palate or both. You would meet with genetics to find out, was this due to a syndrome? Was it due to some familial inheritance? Or like, what is your risk if you have another baby? What is the chances of having another baby with a cleft or another condition? We would talk with the ear, nose, and throat doctor. Usually 90 to 95% of kids with a cleft palate end up with ear tubes. So we're always checking ears and putting tubes in when appropriate because lack of hearing access can delay speech. So if they have poor hearing, then you're at risk for poorer speech in addition to the cleft palate.
So you said there's a high correlation there.
Yeah, 95%
Wow.
I think of kids with cleft palate end up with ear tubes. It's the same muscle. So if the roof of the mouth isn't closed or fused in the mouth, the same muscle innervates in the ear to open your eustachian tube, or that tube you think about when you blow out on an airplane to like pop your ears. You can't drain that tube very well if the muscle is not put in the correct place.
Okay.
So a lot of our kids end up with a lot of fluid in the middle ear, requiring tubes since the muscles aren't doing their job correctly.
So you're a speech pathologist by trade?
Correct. Yes, I'm a speech pathologist.
How did you get into that? What made you get into that line of work?
I liked healthcare, but didn't want to be a doctor, and I liked teaching, but didn't want to be in a classroom. Too many kids. So it was a good kind of mix, and the opportunities to work as a speech pathologist. You can work in a school, you can work in a skilled nursing facility, you can work for the county, you can work in a hospital. It's a really great job.
And there's a shortage of them. I mean, it's in high demand. I know the school district is always trying to find them.
Everyone wants speech pathologists. So it's a master's level program to be a speech language pathologist. There are SLPAs or SLP assistants. I think that's an associate's degree, but I didn't grow up in Texas, so I'm not sure.
You got here as fast as you could, though, right?
Surely, especially for the summer. I love it. It's highly competitive to get into those programs.
Well, and since this affects speech so much, talk about the importance of speech as you're developing as a child.
Sure. So kiddos with a cleft palate don't have the ability to babble or jargon with the same sounds that other non-clefted kids or infants do. So at 6 to 9 months, a non-clefted baby would be saying ba ba ba, ma ma ma, da da da, ga ga ga, making all these mouth sounds, where kiddos with cleft palates, because the roof of their mouth is open, they're unable to produce oral pressure, so they can only make a handful of sounds. So ma ma ma, na na na, some vowel sounds. So they're already delayed or at risk of developing other speech patterns because they're not able to produce those sounds like other babies. So until we repair the roof of their mouth, usually between 9 and 12 months or 9 and 18 months, depending on the patient, they're kind of at a disadvantage where they get less sounds to choose from or to play with.
And then add to that
and then the hearing,
to the hearing, it's a double whammy.
Right. So if you imagine if you imagine being underwater in a swimming pool or in the ocean, that's what the fluid in the ears sounds like. So not only are they unable to produce a variety of speech sounds, they also hear like they have liquid in their ears.
So you have to medically treat it first, then you can start working on developing the speech. And
correct. So we try to give the families a home program, but even before palate surgery, of things to work on so that the kiddos don't develop aberrant or poor speech habits, and giving the parents, if you see this, don't encourage this, don't discourage it. You're not going to tell a baby like, no, but model this instead. So just things to look out for, because if we encourage like grunting and growling and things like that, once they have their palate repair surgery, they may just use their throat for a lot of sounds rather than trying to use their new structures in their mouth.
Okay. And so if you're going down that road, right, at what age, if somebody comes to you, is it kind of too late or alarming as far as developmentally?
I mean, I've treated patients as old as 54, so you can never undo you're never too old to teach a new trick.
Okay.
It's a lot harder, just like nail biting or any other habit. It's a lot harder to undo something in a teen if you've been doing it this way for 16, 17, 18 years. It's better to do it the right way the first time or get in there as early as possible.
Yeah.
We start some therapies as early as like 12 to 18 months just with modeling. And that's in each team visit, we try to give the families things to work on at home. If we're not recommending true therapy sessions, we want to encourage the families to model this way.
So normally when people think of Shriners, they think of the Children's Hospital, right? They
Correct.
think of kids. So
Yep.
your department actually will take a wide range of ages.
So 54 was at a previous institution, and it was also a children's hospital. We needed an exception to the rule. Shriners is a children's hospital for patients typically 0 to 18. We complete care up to 21 usually, just because we have to wait for their skeleton to fully mature before we complete all of our jaw surgeries. So we get a little bit of wiggle room, but it is, yes, a children's hospital.
So how many surgeries? I mean, if you're talking about waiting for them to.
Sure.
How long does that take?
Sure. So you can do your lip repair somewhere between 3 and 6 months if you have a cleft lip. Palate repair between 9 and 12 or 18 months. Then we're talking about braces potentially. We're talking about an alveolar bone graft. So they take a little piece of the hip bone and put it in the dental ridge to give the teeth a place to anchor. That's usually between 7 and 11, depending on dental maturity. Then we're talking about potentially more braces, so more orthodontic care. What else am I missing? Ear tubes can be at any time throughout this, or any ear surgeries. And then we're talking about jaw surgeries. So a lot of times our kids' jaws, because of the surgeries, the upper teeth are behind the lower teeth. So once they reach skeletal maturity, we do surgeries to get their jaw in good alignment if it's not able to be achieved with orthodontics.
So this is pretty much an 18 to 21 year commitment.
Yes, correct. Mm-hmm. Yeah. So we would hate to do it too early, that we shoot for, we think your jaw's going to stop, your chin's going to stop growing here, let's move it here. And then they have a huge growth spurt at 19 or 20 and we undershot the surgery.
And you guys take patients regardless of ability to pay.
Correct.
Talk a little bit, if you know about it, the kind of the history of how that started and just kind of it's got a rich history, Shriners does.
Sure. I think that they just want to make sure that every patient has access to care no matter what their insurance status or uninsured, or we have a large amount of patients within the United States from several states that come to us, as well as patients coming from Mexico, Central America, the Caribbean islands. We have a few even further than that come to us. So we have a strong population of kiddos that deserve and get the same care no matter.
And this is all done in Galveston?
Yes, we meet as a team in Houston. Just to on Wednesdays we hold our cleft team in Houston. All surgeries are done in Galveston just to keep things centralized for all the providers.
And you guys finally are you guys finished with your remodel? It's a beautiful facility now.
Progress.
Yeah, it's amazing what they're doing down there.
Yes, it was dusty for a while.
And so you said you've been there 5 years?
Correct.
And what is it you most enjoy about working, not only at Shriners, but with children specifically?
I feel like empowering parents, making a difference, seeing some of my kiddos who were told they're never going to be able to do X. Let's get them to be able to do that thing. So I feel like there's a lot of myths about cleft care, or cleft speech therapy in general, that it's really difficult therapy to do, and it just takes it's the same therapy as working with an R or an S or any other sound. It just takes kind of the medical knowledge and background. So a lot of the time I'm evaluating a patient in clinic, I'm then calling their school or community speech pathologist to kind of coach them or help them or empower them to say, you can do this. This is not a medical issue. Let's work on these sounds, and here's how we can do it together. And then I'll reevaluate in 6 months or a year or however to keep the process going.
So it's not just you at Shriners working with a team, you're working with the parents, you're working with their schools.
Correct. So sometimes we're able to do some teletherapies. A lot of times I'm collaborating with community SLPs. They're either getting school or like clinic-based therapies. Very few, a good amount live in Houston, but a lot of them are spread around the state, around the country. So I'm trying to give the best care possible to all of them, giving them the best speech outcomes possible, and empowering whomever is working with them as their therapist to do the best job possible.
Well, I want to thank you first of all for the work you're doing, because it's important, and it's so nice to see people taking care of these kids that otherwise would go through life with either a disfigurement or worse,
Sure.
speech problems. Is there anything else you want to tell us about the program or Shriners Hospital?
No, I just think it's a great program. We have a lot of great members of our team. We're all working very hard to give the best quality care to our patients.
Well, thank you for being on the show.
Thank you.
Appreciate it.